All right. Hello and welcome to Catalyst for Healing. Today I am accompanied by Dr. Richter, aka David.
Nice to meet you.
Maria Lloyd, our wonderful therapist, and I am Dr. Yanuck, also known as Justin. So today we're going to be talking about probably the most common question we get, which is how to prevent a bad trip. So let's start here, Dave. What do you think people mean by bad trip, and how often do you get that question?
I would say the whole idea of bad trip is either anecdotal. Patients have heard it from someone, and they've been warned about this type of therapy, or they have truly had what they would describe themselves as a bad trip. I would say with this therapy, one of the most important things is the set and the setting. That's something we talk in the therapy a lot. The set, more talking about the mindset that you're going into the therapy with. One of the things that tends to almost do patients a disservice is the idea of having a true expectation, like a goal that I need to accomplish during the infusion, during the therapy. Unfortunately, the whole paradigm of the therapy is also allowing your mind to find that inner healing through what it needs to work on, what it feels ready to work on at the moment. And if you try to set a goal that's more from what you expect yourself cognitively to accomplish, it might just really divert your mind from what it needs to work on at the moment. And the expectation itself can just feel disappointing.
And that's really the power
And the medicine gives you distance from it.
Right. That's really the power of this whole thing.
Experiencing it.
Totally. And of course, like we can't even guarantee that you're going to feel that, right? The second we try and say, okay, like we're going to try and unlock how this trauma affected you is the time where you're going to go in there and you're going to swim with fishes or something. Right. Like this medicine works in very curious ways where really you get the most from it when you try and do the least with it. Right.
Yeah. It tends to bring up what's live and active in the present moment.
Totally.
So, I mean, let's say, I think that's one of the harmful things, like you said, is people coming in having all these expectations. But if they're just present and going in with that let go, surrender, be open, it will bring up things that need to be brought up that are currently in your subconscious, right?
Yeah. So Dave, you talked on two topics. And these are like, if you're remotely in the psychedelic space, these are huge buzzwords of like set and setting. And to the point where it almost feels cliche, but it's cliche because it's like, it is so critical to it.
Correct.
And so when we talk about mindset, so we're going to kind of get into like how you can get the most from the experience and not necessarily prevent a bad trip, but also just to have the most meaningful experience that you can. Because that's really where the framing is. So let's go into mindset specifically. What do you recommend to people before they come into it and during it to have the best mindset?
And I would segue on that, having a bad trip. I mean, that's just, your mind really is able to explore essentially anything when it feels supported. And so that's something that when I was going through actually the ketamine-assisted psychotherapy training, I've met people that have had bad experiences. And the one thing that they agreed on is just their mindset wasn't quite prepared for what they were about to witness themselves. Because in a way that therapy allows you to live and witness at the same time. And that can be a real power where you can almost be somewhat absorbed from your experience while witnessing it and process it at the same time on such a deep emotional level that it can be, in a way, somewhat unsettling, of course. And the mindset that we try to prepare you for is that I really try to work with patients on trusting themselves. A lot of patients, the one thing that they come in with is they do not trust their own mind. Hence all these questions. Am I going to become psychotic? Is it permanently change my personality? Right? Things like that. And the short answer is we can allow you to trust yourself as providers. And that's literally what we try to work on to get you into the right mindset, is to allow you to trust yourself. Trust yourself that your mind during the therapy will take you where it's ready to go. And so what we do a lot of the times, it's, yes, in some ways it's cliche, right? preparing you to not have super high expectations or work on a particular goal when you're not ready for it. So, when we go through the series of infusions, a lot of the times we try to work on, at first, really just priming your brain to even be able to face whatever's there when it's ready to do that, not rushing that process, because it is so personal and so intimate in a way.
Mm-hmm.
So we're there more to just get you in the space that you feel comfortable with. And that means the mindset, basically. So the typical things are breath work, meditation, having the patient, have a prep session with therapists, ideally, time before the first session. And then it's allowing kind of a guidance through right before we actually start the infusion. So the patient actually feels like they're in the mindset where they feel supported and they trust themselves to actually go through it.
Mm-hmm.
So that's what I would say is that sense of security, not only with the environment, but especially with their own mind, that they will be able to basically heal within their own mind and not go the other way, which is hurt themselves. Because a lot of it is tied to trauma, and a lot of the times it's impossible to actually look at that side of yourself, look at those parts of yourself, because it's simply too traumatic. And that's where, we build all the defense mechanisms and all of that. So in a way for us, it's just really to facilitate this feeling of security within self, that your mind, that inner healing intelligence will guide you through it with us simply supporting you. So
how do you prepare patients for this?
Well,
which is perfect for you, right? Because that's something that you do, especially in prep.
And this is where I have found it really powerful to do sublingual ketamine with my client in my office, because we have this really safe relationship and we're introducing the medicine, and there's a lot of power in being able to integrate it and be with them throughout. But as we've talked about, there's different ways of receiving the medicine, and then there's different benefits to doing IV versus sublingual, because people might need more of the medicine to get the benefits with a more severe case, conditions that they're coming in with. But as much as I can, I'm preparing them in advance for, and again, you guys have a setting that is very safe, and you have nurses and doctors there throughout, and you have that calming presence, you have meditation, you have music. So it's preparing them. And that's why I love partnering with you guys, because I feel like we're kind of back and forth with the clients, making sure they feel safe there, but then also with the processing after, whether it's with me or another therapist, and having that transition be where they're feeling really taken care of in the process is super critical. One of the biggest things, and that was a concern that we've talked about, is some of the very medicalized setups right now with ketamine clinics all over the US is it can be very transactional, very little connection emotionally. And the majority of these clients have CPTSD, they have attachment trauma. So getting activated by not feeling safe and taken care of can be really detrimental, I think, for a trip.
Yeah.
Justin, good question for you also. What are some of your techniques that you kind of prepare the patient, because you're there?
Yeah.
So we are in the clinic a lot of the times, especially with IV therapy.
Yeah, it's tricky. Like, I think in an ideal world, of course, they're meeting with someone like Maria beforehand, or have worked with Maria beforehand for a long time, and they have that relationship. But I think, practically speaking, not everyone's going to get that. And I think for me in the clinic, kind of my general sense is I try and create in that moment, look, you are safe. This setting is completely optimized to make you safe. This is your space to really let go. And when they're in the chair, we do a little bit of a guided meditation to kind of really relax them and get them into the kind of the right mind space. But I always remind them, I have my mnemonic of TLO, trust the process, let go, be open, right? And I think going back to that for each time with patients is really helpful. And then I think I like to remind them, go to your breath. If it ever you are going to a place that is uncomfortable to you, that you feel like, oh my gosh, I don't think I can handle this getting more intense, go back to your breath. And that's such a grounding force. And I think going through that in a controlled, safe space and coming out the other side is so valuable for their everyday life where they feel like they can't go through difficult things, right? And they take these medicines to suppress those difficult things, right? They just want to be numb. And then the last thing is just to like float down the river, right? And I think this is a helpful guide for any type of psychedelic experience, is not to try so hard to grab onto the side and like, oh, I want to focus on this thing and like I want to explore more. Just keep going. And I think the more you really try and not go anywhere in particular, but just go with the flow, not only in the experience are you often going to get more from it, but I think it translates to life as well, where we have very little control over so much in our life. And I think recognizing that is really a superpower of like, just go with the flow. Control, or our desire for control, is the root of so much of our suffering. When in reality, like, just go, just got to go.
Right. And actually, I would say, I mean, breath work. I mean, I touched upon it before, but it was so key. And it's one of those things that I also remind patients is, like, some patients can be very cognitive based. They're mentalizing and rationalizing a lot of the processes. And the one thing I sometimes remind them, just as we're getting more into just focusing on breath work before we even start anything, is it is actually one of the most essential processes. And it's the one essential process you have control over. You don't have control over the pumping of your heart, blood pressure, or anything on that, but you have control over your breath, and you can ground yourself with that so well, regardless of what's going on. So that is actually, I would say, it's essential.
You're training people to do slow breath. You know, if they start to do fast, you know that's going to activate.
It's true. It's actually interesting. So during our sessions, like, the first step for us when we see, and this isn't that common to be honest, but when we see a patient starting to kind of escalate and start to look, if they reach out to us for help, which we always tell patients, like, at any time, if you feel like this is too much, raise your hand. Like, we have a cue for them. Our way of de-escalating and kind of bringing them down is not to stop the medicine. It's not to give a benzodiazepine. It's to like ground them, bring them back to our space, and bring them to their breath. And it works probably 90% of the time.
Countless times. I swear to God, I would sit there actually and just maybe get the headphone off a little bit and just breathe with the patient. Works much better than if I start messing around with medications. And it can actually allow them to go back into the experience.
Right. Now, have you had clients with bad trips? Talk about that.
Sure, yeah.
I mean,
like, I just don't like the classification of bad trip. I think it's like it provides judgment to it. Or like, at the end of the day, like, all these experiences can be meaningful and you can learn a lot from them. Have we had clients that have had really intense experiences, some of which have been possibly traumatic? Yeah. And you've worked with some of those clients that we've had. But there's like a ton of value in that too. And of course, it's easy for me to say it, not having to go through it. But I think my job is to prepare people for these possibilities, like the things that could come up, or things that maybe you don't even remember that could come up. But just knowing, like, hey, I'm going into this. It's not going to be like all sunshine and rainbows. This might be intense, but like, what I've been doing isn't working. Maybe this is what I need to go through. And if you're willing to accept that, like, we will assure you to the best of our ability, we're going to keep you safe, as well as we're going to be there to support you. And you're hopefully going to have a network of people to support you. But this is like your journey. And the beautiful thing at the end of the day, especially with like IV ketamine, is like, it's always nice for them to know in the back of their mind, like, this can stop at any moment. Right. And I think as these newer things will come into play, which I'm very excited about, it'll be an interesting dynamic with people that are truly psychedelic naive, of having like, okay, here's a psilocybin dose, like 3 to 5 hours now of an experience that we cannot really stop. Right. And there's power in that, kind of really relinquishing control, that I think that's going to be an interesting space to explore with people that are really vulnerable.
Once we get more into other mess that's getting rolled out.
Which is, it's a matter of years.
Time.
It's going to happen. Yeah, for sure. What about you personally? Your experience in this space? You've been open on prior podcasts about your experience with ketamine. Have you had one that felt in the moments like too intense, like, I don't think I can handle this anymore? Or do you feel like they've all been?
I mean, mine have generally been positive, and I would say the majority of clients, it's a positive experience. I have had people that I've worked with that have had some negative experiences, but if we're able to integrate and fully understand what came out of it, then it ends up being worth it, because you're going to grow from whatever comes out of it, right? You're going to learn more about yourself. You're going to be able to heal more. You're going to be able to kind of become who you're meant to be more. And so all of that, I don't know. I think the fear is overblown in terms of how much people carry that versus the reality is the majority are positive experiences.
Yeah, that's true. That's a good point to make. Yeah.
And
like probably
if something negative
90%.
comes out, then that needed to come out, and then you might have to process it, right? And that's why you want to have therapists in place, because otherwise people will go home and then they might be traumatized because they're not processing what came up.
Yeah. Is there something that you've noticed, because you've actually experienced it in different settings too? And I am not fishing for a compliment here. I just wonder generally what you like. How can the setting really tip the scales to let you get the most from it and feel comfortable in it?
Yeah.
What's worked? What hasn't worked?
Well, I talked about my initial experience with Spravato in a clinic where they literally sat you down, took your blood pressure, put you in a room with the nose spray, watched you take the sprays, and then just left for 2 hours. And it was so cold and clinical that I ended up bringing my own blanket, my own eye mask, my own music, because they didn't have any of that stuff. But honestly, like, I stopped treatment for a while because I wasn't seeing results, and I was traumatized by that. Like, there was a part of me that just felt like this just doesn't feel right. And I started learning more about the medicine and then coming prepared and went back to it. But that's what made me passionate about becoming trained, because I started realizing how important the integration was, how important the setting was. But you guys, do that, I think, so beautifully at your clinic. And we're still, there's definitely more awareness of the importance of integration, and clinics are starting to incorporate that more and more. But there are still many clinics that are very medicalized in how they approach it.
Yeah. It's such a tricky balance. And I think it's still something that we're constantly talking about and trying to optimize for multiple factors, right? But I think at the end of the day, leading with trying to give the patient the best experience possible, you're never going to go wrong with that.
Yeah.
Right. And so I think trying to be intentional about that from a clinic perspective, but also from a patient perspective, you have a lot more power in this space than you think. And I think if this is something that you are considering, I think recognizing the things that are going to make you feel comfortable in a clinic, whether that's, knowing that there's going to be someone sitting next to you, or knowing that there's going to be, I don't know, let's say a female provider in the clinic, or knowing that all the little things that could matter to you, you should ask that before you start, right?
Tune into how you feel when you go visit.
Totally.
Because, the people, it's like you guys hire all kind, empathetic staff members. So it's like there's that energy when you walk in, whereas that might, if you need that and that's not there, that's probably going to affect your journey.
Yeah, no, I was just, I would say that I get this question, especially from patients, and I would love to hear what you usually, and you kind of answered it already, Justin, but oftentimes patients will have an experience, and then when they start rationalizing a little bit more, they'll be like, am I doing it right, doc? And you're for sure. I usually do that. So that happens quite often too.
Yeah, for sure.
Usually in the beginning, when they're still allowing themselves to maybe succumb to the experience itself.
Yeah. Such a common question to get, or probably the most common statement I get of a patient coming out of an infusion is, do other people say this? It's so interesting that the one thing that ties us all together in humanity is not wanting to be alone, right? It was we're just wait, other people have this shared experience, right? I'm not crazy. So I usually try and put it back at them, why is it important for you to know that? But I don't try and therapize too much in that space specifically, because that's not necessarily my role. I think to your point, what was your question again? I'm sorry. I was going to go somewhere else with it.
Am I doing it right?
Oh, yeah. Sorry. Yeah. There's no wrong way to do it, right? I think at the end of the day, every person is truly unique, and I think you have to follow what feels right to you. And like you were discussing earlier, and I think it's such an important point to make, is like these people don't trust themselves, and giving them the power to start to trust themselves again and listening to themselves.
Yeah.
Right? Like a lot of times people hear themselves or the subtle signals they get and they're like, oh, nope, pill, drug, whatever. I need to turn that down. I don't like that thing. Right? But it's like, listen to that thing. That's you. You are the best version of you. No one else can do you better. And so I try and empower people to kind of to do that and go through that process. But I think it's also really important to emphasize with people, the experience itself is not determinative of how you are going to do with this medicine.
So true.
And there is mixed evidence with other medicines like psilocybin and MDMA, but when it comes to ketamine, we don't really have much robust evidence that your actual trip or your experience determines how you're going to do at 30 days. Yeah. Right. So at the end of the day, I want you to have a transformative experience, but really I'm trying to give you a safe, hopefully enjoyable experience to get a medicine into your system that then you can engage in psychotherapy and the other things that can make your life hopefully better and reconnected and centered. Yeah.
One more quick thing about bad trips is people may have had bad trips using it recreationally.
Totally.
So it comes into
like I just had a consult with a patient 2 weeks ago that said they were hesitant to ever try it because they did do ketamine once in a club, and they said that all of a sudden like everything got dark and then they were in the corner of the wall freaking out.
And that's how unsafe a club would feel.
So that's also like, I mean, ketamine, let's acknowledge it. It is a drug of abuse. Like people can recreationally use this. It's rarely that some people are using it more than recreationally, but it can happen. Yeah. But yeah, that's not how this should be administered. It's a really powerful medicine that when given in the right space can be transformative, but it can...
It's the same with all the psychedelics, because you see that with psilocybin, with MDMA, where people have these traumatic experiences because they're doing it recreationally. Yeah. They're not getting the support to integrate.
Yeah. And that's where the cliche setting actually come in. That's what we try to take care of. Yeah. I mean, I don't know that there is much of a data how key they are in the process itself, but just from anecdotal being working in the clinic it's huge. It can literally make the patient's experience.
Yeah. For sure. Anything else to add? There's something the last thing. Okay. We probably talked a lot about a very small topic, but it's like the question that I get the most, to be honest. So to really hammer it home, I mean, there really is in the clinical setting, the risk of having a quote bad trip is extremely low. The vast majority of people having a really powerful transformative experience. Your mindset going into it, which is largely curated by both your therapist, your doctor, and then your own work, and the setting that you're getting is everything. And so if you ever have questions about that, you can always comment to us, on the video, or you can reach out to us through the podcast. We'd be happy to talk more about it. It's a super important topic we're all really passionate about. But that's it for now. Thanks for joining us, and we'll see you next time. Bye, guys.
Thank you.
Bye.